right. So I'm going to try to power through this. It only took me like half an hour last time, so I'm really trying to give you guys some free time out of this hour here. So some of the stuff is just kind of friendly reminder stuff, stuff you've probably already heard before, but just kind of doing a yearly reminder just for, the sake of doing it. The first thing I'm going to talk about briefly is confidentiality. I'm doing things a little bit differently with communicating information at the beginning of this year, so I'm putting in my little confidentiality disclaimer here in the beginning. I spent unending amounts of time on state statute and policy and procedure this summer, which probably made me a little crazy, but I think it prepared me for letting you guys know what you need to know as far as this kind of stuff. So basically, what it comes down to, I've got a booklet here from the DPI in Wisconsin, and it says, may school district employees and other school district officials access patient health care records without written consent? And the answer is patient health care records maintained by the school may be released without informed consent to school district employees or agents if access to the records is necessary to comply with the requirement of federal or state law. State law and federal law does require us to provide for the health and safety of the children while they're here. In order for us to be able to do that, there are certain things you need to know when you have 30, 70, 90, however many children coming through your classroom every day, some of them with significant health or mental health issues. So those things are communicated with the understanding that we are, as a school, are trying to keep those children safe. As then, obviously, like I said, I know you guys know this, but as a disclaimer, Wisconsin State Statute, section 146.82, says that school district employees obtaining information from patient health care records must keep that information confidential. I know you all already know that, but if something's passed to you, it's to try to keep that child safe, and that's not something that you can disclose. Examples that I've been given through my career are, okay, if that's something like you have a really bad day at work, can you go home and write on Facebook, oh, I had a really bad day at work because one of my kids was really medically unstable. That's pretty vague, but no. Because especially in a small town like this, if they know who you are and they know who the 33 kids are in your class, they might be able to deduce who you're talking about. So that's still a disclosure of health information. If somebody walks up to you in a public setting and it's very clear that they're best friends with the mother of a child, and this mother has given them unending amounts of detail about this child's health history that maybe you don't even know, and they're asking you questions about how that goes in the classroom, that's a lot dicier, but it's still a situation where that parent can tell anybody anything that they want, but we can't. So that confirmation to come from a parent is one thing. The confirmation of, yes, the child has it and this is how we're managing it in the school is not something we can do. I know it socially sometimes makes for hard situations, but something like, well, we every district has children with health concerns, and we do anything we need to for any individual child to help take care of their health, whether here in the building, regardless of what the situation is. And something generic like that should hopefully suffice. So that's that. What I'm coming up with for this year, I tried to think of the best way, and this may need tweaking. I'm more than happy to work together on if this is the way that works or if I should do something different with it. But what I'm doing for this year is I'm actually coming up with a folder for each teacher. So kind of what you're each going to get is, this is what it looks like for the high school. For the elementary, it's a little bit different. But like this is Senior Allen's. What I did on the front, I put, these are the courses I understand you to be teaching this semester, which may or may not be correct, because I'll be honest, I've gotten pretty proficient at Skyward, but I'm not a pro. So if I'm missing something, please let me know. And then inside it will have the list for each of those courses. So class number 151B, LB1, this is who I understand to be in that class, and this is the information that you need to know, only need to know kind of stuff. Is there a severe allergy? Is there, that kind of stuff. And then if there's a child with a really significant health concern, you may have a plan, and then it'll say attached. And then there will be something on the back that says, with this child, this is what you need to know. So that's kind of how I've done that. I'll be honest, it took a little time this summer to get the finalized, class lists and course things and all that kind of stuff. So they may not be exact. I'm kind of asking a little bit at that point for you guys to kind of look at it and go, okay, I see there's 20, it says there's 22 students here. My class list now says 21. I clearly lost somebody. Did I gain anybody different? And then if it's a child that I may not have known was in there, kind of hover over them. If they've got a health concern in Skyward that's flagged and you have a question about it, please let me know. If I've completely missed a course altogether, let me know. And I'm more than happy to add that information or get you what you need. I'm almost done with them, but I'm still getting together some stuff on some of the kids. So I'm hoping to have them in your mailboxes by the end of tomorrow. I'll still be doing that district-wide, things that you need to know just about kids in the building. So if you're covering recess, if you're out in the hallways and there's a child that has severe asthma or has a severe heart condition, and you can see a child that's kind of in distress and you go, wait a second, is that the kid I remember that had? Because I can't be everywhere. So for you guys to know that and be able to go, okay, yes, that's the kid. I don't remember, I don't know any details, but I remember there was something about this kid and this kid looks like they're having trouble. I don't have them in class, but I need to know that, let somebody know that this kid is having a hard time. So I'll still be getting that. I think I forgot to mention this last time. That's what they get for being in the first one. But I'm hoping you guys can always also use this as communication for substitutes. So, feel free to, if you're getting records from the special education department, and it's something that should go from one class to the next on a kid that has a special education plan. If you have your own notes to add that are appropriate, please feel free to do that. And then if you're calling in sick or you're not going to make it, maybe one of the things you want to include is, hey, just so they know my health binder is secure in X, Y, and Z a place. Because obviously it needs to be kept in a place where kids can't go, finagling around in your stuff and find it. So that's something that they can use, and then any substitute coming in at least knows if there's a kid with a, significant health issue, heart issue, a severe allergy, anything. They know what they need to know in order to safely have that child in their classroom that day. So that's the plan with that. Does anybody have any questions on that or on confidentiality stuff?
That's awesome. I got my folder. Thank you.
Yeah. It was my little brainchild for this year, and I don't know, sometimes I thought I was a little nuts because it's been a lot of work, but I think it's the right way to do it. And certainly with still keeping in mind what health information, needs to be protected and what needs to be conveyed to keep the child safe. So I did, really do a lot of thinking about, what should be and what isn't, but if you have any concerns about any of that, please let me know, and I'll be happy to work on that with anybody.
Just one question, maybe you'll get to this. It has been past practice if we have a field trip or something that we take the list of the kids that we're taking on a field trip to the nurse and then information and pack the bag accordingly. Is that still the?
Yeah, so that's actually my next thing. I did work on some of the medication procedure and policy. And so there was already something written on field trips. It's basically the same, but we added a little bit of meat to it. It's just a little more structured. So it says that you will try to notify the health office in advance 14 days of a field trip with a list of students who are going. I understand, like the end of last year, you might not have known until 5 days before that you were going. If that's the case, obviously I understand. So as soon as you know, or as soon as is reasonable, if you can give us that list of students, then in the policy it will take us less than 2 business days to turn around and let you know what you need to know on those kids and get you that list back. In the elementary, it's a little bit different in each building. In the policy's all encompassing, but the way we're actually going to procedurally handle it is a little bit different. In the elementary building, you will still be coming down to the office and picking up a backpack, and that will have the EpiPens, the list of things you need to know about kids, and that kind of stuff in it. So you can pick that up the day of the field trip. In the high school, really most of those kids are carrying their own stuff. So what we're going to do is put a standardized first aid kit into each classroom. That's going to be checked every 6 weeks to 2 months. Or if you know you used something, please let us know. So you can just, once you get the list from us, you've got your list. Those kids should have those things on them because most of them have releases to carry their, their albuterol and their EpiPen and their diabetic supplies and their heart condition stuff. And, most of those kids have that stuff on them because they're really much more autonomous at that point. So you should just be able to grab that list of information, your first aid kit from your room. First aid kit in your room you don't have to use during the day. That's what we're here for. So if anything happens during the day, we are supposed to keep track of injury and illness. So please let us know if things happen, and please if things happen during the school day, send them to us. Because we're keeping track of all the owies and boo-boos and bad stuff, or not bad stuff. Or let us know if something happens on a field trip. So, and that will be in there also. So in those first aid kits, I've got a first aid card, and there's also like if you're exposed to blood, and then there's just some basic first aid stuff.
Does the field trip policy transfer over to athletics? You're taking a team?
No.
Okay.
I'll be honest, it's really, we as a school are responsible for the students anytime they're under our care, is the state law. That's a really big rule. You do the best that you can. It does include sports, and it does include field trips. I worked really hard on the field trip part of it. The athletics part of it, I worked pretty hard with Nate Zemer to try to get, we're going to try to do standardized first aid bags.
Right.
Those first aid cards are going to be in those bags too.
Yeah.
So that at least that's kind of the rule of, hey, if something happens, this is what we want you to do.
But you don't need a list of...
Well, you are getting, when they sign up for the sports, anything that the parents give you on those health information. But to be honest, that was way too big of a job to get on top of at that point. Hopefully they're giving you what you need to know on those release forms when they're signing up for sports. Maybe you guys can tell me. I hope they're really good about it, telling you what you should know.
Right, and then you should get copies of all of them, or just
Right.
have all the
Yeah, I
information
just
on
didn't
it.
know if
So you.
needed a list of the roster of that.
No,
Okay.
no. For now, that's one of those that it's like, well, it's kind of up to the parents and the coaches to communicate that, and hopefully on those sports forms, you guys are working it out and they're giving you what you need to know. But I'm not really dipping my fingers in that, other than trying to make sure that those kids are in good shape. So that's a great question.
Great answer.
Yeah, thanks. I don't know if it's a great answer, but I tried. I think somebody else asked in the last one too. There's a lot of kids who have asthma, no inhaler. The teacher said, she's been here for a long time, and she said just about everything that can possibly go wrong on a field trip go wrong, including children who have asthma attacks that don't have an inhaler on their body, using an EpiPen, and those kind of things. So, I know there are some of those things that we're going to have to tackle. I think if you're going on a field trip that's really physically intensive, and you see on your list that, your plan for the day is it's springtime, so the pollen is out, and sometimes kids who have asthma have allergies also. So you go, okay, this kid's got asthma, it's springtime, and we're going for a 3-mile hike in the woods, and it says they don't have an inhaler. If you're not comfortable with it, then, make my department do the legwork. We will contact the parents who will say, look, this is a little bit more of a field trip than some of the others. We really want to have that inhaler. Maybe they don't need it every day while they're at the school in this contained environment, but we really would like that inhaler to make sure they don't have breathing trouble while they're not, while they're out and about. So then that goes back to the EpiPen and glucagon and oral medication training. Basically with that, you guys all did those online CBTs, the training things. The good news about that is that you don't have to do that for 4 years. So yay. The bad news is that it doesn't actually really make you competent. So part of that has to be a skills check off with me. So I promise I will make that as painless as possible. You cannot by law be required to do that training. So I cannot force you to become competent in EpiPen, but here's the thing. If you want to go on a field trip and there's a kid that has a bee sting allergy and has an EpiPen, you can't go on your field trip unless somebody else on the trip that's an adult, that's a staff, that's a district employee has training. So my hope would be that you still all make the choice to get EpiPen training. You know, I promise I will try to make you as comfortable with it as possible. I hope it never happens. But at least, you know, if you get the training when you're ready to go on a field trip or something comes up, it's not a thought. So both buildings, I'd like as many of you to get the EpiPen training as possible. As far as the glucagon training, in the elementary level, really what we're doing with any kids who have diabetics is that, you know, the nurse, the health aide, or a parent are going along. So the glucagon training really in the elementary building, unless you have a child directly in your class, or you want it, I have no problem if you're just like, hey, I really just want to have a certification. Totally cool. Or if, you know, you feel like you'd be more comfortable on recess duty, or, you know, but there's always somebody during school hours who have the training, and anytime you're on a field trip, then there will be somebody with you who knows already how to do that in the elementary level. Sports might be a little different, you know, if you're doing sports, you know, you might want to have that too. In the high school level, because they are so autonomous, again, and they do usually have their stuff with them, and they know how to self-administer, but obviously the glucagon is for cases when they may not be able to self-administer. So we are required by law to send somebody along who has glucagon training. So at the high school level, I would like as many of you to get the EpiPen and the glucagon skills checkoff done. Again, so if the case comes up where you've got a diabetic or you've got a kid with a bee sting allergy, it's not a thought, and you just go. You know, you have the medical information, you have the training in your back pocket. I hope you never have to use it, but then it's just taken care of. The only other piece of that on the field trips is that there are very few kids in the district that take oral medications here during the day, but that is the only thing that can actually be delegated to you. So, you know, somebody can say to you, Jackie, you're taking this field trip, you've got 2 kids who will have oral medication, you're going to be the one administering it. So they can actually delegate that to a district employee, just oral medications, so pills. Medications administered by any other route can't be delegated, you have to be willing to take on that responsibility. So having said that, it won't come up very much, but sometimes at the end of the year, basically every kid in the district is going on some kind of field trip. So if you're planning a field trip and you get your list back and it says, hey, little Jimmy needs to take a pill at noon while you're out in the field, then we'll say, here's the link to the training. So I think we'll just do that as needed. So there's just an online thing, kind of like that other thing. When you get done, you print out the certificate, I stole Chris's, that says, yes, you know how to give oral medications. And then we just go through a checklist quick. So my plan is, because that will probably only come up 4 times a year, where a kid that has medications is on a field trip, we'll just do it as needed. Is that okay? Does anybody have any questions on that? You know, unless you're in a room where you have several kids, you know, special education, sometimes there are departments where, you know, you might be administering and then you guys might just want to do it in case you need to be handed a pill and administer it that day. But for the rest of you, I think it's just like an if it comes up kind of thing. So that is that piece of it.
Is there going to be scheduled times for the EpiPen and glucagon, or are we supposed to contact?
Just find me. I mean, I'm really comfortable. I think even if 10 or 15 people pile in on me at the same time, I think we'll be fine. A group this size is a little bit harder to control, you know, because I can't get, you know, you guys might not be comfortable asking questions, or it's a little bit harder for me to get an individual read if I think somebody's just kind of not really understanding it. But just find me in the next 2 weeks. I'll be here, and you know, the next 3 days, once I'm done doing these, and then you know, Thursday and Friday I'll be around. I know a lot of you probably aren't going to be around on Friday, but you know, you can find me. Like I said, even if it's a whole bunch of you, I'm just probably going to do that kind of laid back, if that's okay with everybody. It's not as structured. So that's that piece of it. And then I'm going to do the bloodborne pathogen training just to get it done. I know in the past we've done it online, and that worked really well for a lot of people. But the good thing is, or the bad thing is that some of your coworkers really needed a lot of babysitting and hand-holding in order for them to get it done by the middle of last year. So they're going to just force feed it at the beginning of the year again. But the good news is we got rid of the test. So I just have to sign my life away saying that yes, I did indeed tell you what you need to know about bloodborne pathogens, and I gave you the opportunity to ask me questions, and then you don't have to take a test. So we will delve into the wonderful interesting topic of bloodborne pathogens, which I'm sure none of you have ever heard before. So, but certainly stop me if you have any questions. So what bloodborne pathogens are viruses, bacteria, and other microorganisms that are carried in the bloodstream or in other potentially infectious materials and can cause disease. There are over 20 different bloodborne pathogens, but obviously the ones that we are most concerned with are HIV, hepatitis B, and hepatitis C are the ones that they most commonly worry about. The other things that they can worry about are different types of acute conditions, viral hemorrhagic fever, Creutzfeldt-Jakob disease, arboreal infections, which are like these bird-borne things that you could only get if somebody was, actively disease-ridden at the moment when you were exposed to their blood, syphilis, and then some of the tick-borne diseases, malaria, things like that. So again, those are less common, but they would have to be actively ill with those things at the time you were exposed to their blood. The things that are besides blood that are included in the potentially infectious materials are plasma, amniotic fluid, spinal fluid, semen, vaginal secretions, peritoneal fluid, which is the fluid that your organs are floating in your belly, breast milk, unfixed tissue or organs, any of the fluids surrounding the brain, spine, heart, or joints, and any other fluids that contain visible blood. If you're coming across those things in your day-to-day line of work while you're here, we have a lot bigger problems than a lot of things. So if you are seeing spinal fluid on a regular basis, please let me know. I probably need to talk to somebody about that. How do they enter the body? If you have a break in your skin integrity, so if you're stuck with a needle, if you have cuts, scrapes, or breaks in your skin, and then if you're splashed anywhere on your mucous membranes, which is anywhere that's soft and gushy and wet in your body, your eyeballs, your nose, your eyes, that's another place where they can. And then also lifestyle issues, which they say as IV drug use. I take no responsibility for your IV drug use in your personal time. If you're doing it at school, I have a problem with that. No, just don't do it. So OSHA's bloodborne pathogen standard is to reduce occupational exposure to hepatitis C, hepatitis B, HIV, and the other less common things that we have discussed. Anybody who's covered by this standard is anybody who could be reasonably anticipated to face contact with blood or potentially infectious materials. I don't know that any of you should really be reasonably anticipated to come across those things, but it is possible. You've got kids, they're active, they run into things, they hit things, stuff happens. So that's why you still have to have this training. Their disclaimer here is that any Good Samaritan act you choose to take part in, like helping out a coworker with a bloody nose, is actually not your job responsibility. So that's a Good Samaritan act and not considered a job hazard. So don't help your friends with a bloody nose. So HIV is the virus So HIV is the virus that causes AIDS. The prevalence in the entire state of Wisconsin is only 9,500. So obviously because of the larger concentrations of people in larger cities, a lot of those cases are in the larger cities, but there are smatterings of HIV in other counties of the state. But it's only 9,500 people in the entire state. The incubation period is 1 to 3 months, but the person is infectious from onset throughout their life. Anybody can get HIV. It's a non-discriminatory disease. Symptoms in the acute stage include fever, rapid weight loss, night sweats, and pneumonia. So here's the risk of transmission piece. So even if you're stuck with a needle that has active wet blood on it, the risk of transmission of HIV is 0.3%. If you get blood that has HIV in it splashed on a mucous membrane, the risk of transmission is 0.09%. If it's on non-intact skin, so you have an open cut, you are in copious amounts of blood that has HIV, it's actually even less than that 0.09 for HIV. So there is still some risk that exists, but it isn't highly transmittable in those ways. Other risk factors for acquiring, for acquiring it would be a deep injury. You know, you have a very large open wound and blood gets into your very large open wound. You sustain an injury with a device which is visibly contaminated with active blood, and you are injured with a needle that's been placed directly into an artery or a vein. So it's been in a vessel, not just on the skin. And then if the patient is in the terminal stages of AIDS, obviously their viral load is much higher, so then the amount of the virus able to be transmitted is a larger amount. Hepatitis B, there are only 700 cases. So HIV, 9,500, hepatitis B, there are 700 known cases in the entire state. The incubation period is 45 to 180 days before you actually would test positive for active hepatitis B. Any unvaccinated persons are susceptible, so the district does provide the ability to get the hepatitis B vaccine. It's a 3-series shot, and they do cover that. I think in the past they've had people come here, not something I was able to organize for last year, something I'm hoping to have, thinking about and have in place that any of you who don't already have it can get it if you want it. And then symptoms when you're in the acute stages of the disease would be fever, muscle ache, fatigue, and jaundice or yellowing of the skin. That's because the liver's having trouble functioning. The risk of transmission for this is higher. So if you're stuck with a needle, the risk of transmission instead of that 0.3% goes up to 22 to 31%. Still not a huge risk, but if there is blood on a needle and you're stuck with a needle of somebody that has hepatitis B, there is more of a risk that you could get it if you aren't vaccinated. Then if there's any direct or indirect contact with skin or mucous membranes, is also, they don't give a percentage for that, but it's good to keep in mind as occupational hazard, don't eat blood. I guess is what I'm trying to say. The virus that causes hepatitis C, this is actually the largest by the other two combined and then tripled. So there are 25,000 cases of hepatitis C in the state of Wisconsin. Hepatitis C is also the one that they don't have a vaccine for. So it's a bloodborne pathogen, same thing, you can get it from a stick, but it is a little bit more prevalent. It's still not always something that can kill you, but it makes you really sick and you kind of have it forever. So you can get acutely ill, and that's usually how people are diagnosed. Then it can stabilize for several years, but then it typically affects your liver function later in life. So still not something you want. It leads to chronic liver disease, liver cancer. Again, this is one that anybody can get, non-discriminatory. And then the symptoms are the same as hepatitis B, the fever, muscle ache, fatigue, and yellowing of the skin. The risk of transmission in the needle stick, remember that we had the 22 to 31 with the hepatitis B, we had the 0.3% with the HIV, this is 1.8, so not quite in the middle, still on the lower end. Risk of transmission through those mucous membranes or non-intact skin is very rare, they're not even giving me a percentage. So again, these things aren't really highly transmissible, even if you are coming into contact with blood, it's not really highly likely that you get it, but still don't do it. We do have a bloodborne pathogen control plan. It's about this thick. I have it. If you want to read it, I can get you a copy. I think it is on the shared drive. You can probably access it. If you don't want to go looking for it, just let me know. If you have a dying desire to read it, I will get that to you. Just let me know. It's no problem. Then they're kind of getting more into people who are actually providing direct care to patients, phlebotomies, finger sticks, and immunizations, or handling specimens of blood or body fluids. I don't want any of you doing any of that. So we're good there. So basically we're just worrying about hand hygiene. Anytime you are taking care of somebody on a field trip with blood or an issue like that, wear gloves. Don't get it in your eyes or mouth. I guess that covers it. And then waste disposal, if you're in the building and there's blood or anything on anything else, you aren't expected to clean it up. We have people who are trained to do that, who know the right chemicals to put on it. Let us know where it is and we'll get the right people there to take care of that for you. And that goes on the buses too. If they have something happen, we take care of that. Waste disposal, so they want you to use, I don't want to skip this one. So basically what they're saying is you've got to use those standard precautions, gloves, careful not to come in contact with those things. And then their rule here says if it's wet and it comes out of somebody's body, you treat it as infectious. which I think is a good rule. It gives you a good visual. It's wet, came out of someone's body, don't touch it, it's gross. Or put gloves on first. So that's kind of the rule on that. So they've got, the rules on alcohol, hand gel. If you guys have got that around and your hands aren't visibly soiled, you can certainly use alcohol rubs. They do want your hands to stay wet with that for 30 seconds. That's kind of a long time. So if you're not using enough, that it's actually as long as if you were washing your hands, you're not using enough. And it hasn't actually done what it should do. So the same where you're washing your hands and they usually say sing the ABCs or happy birthday, it should actually be just as long with the alcohol sanitizer, actually even a touch longer. So if you're not using enough to do that, then it didn't count. And then the hand hygiene, like we said, it's the 15 to 20 seconds. And then they're really getting into, body gowns and shields and masks. And again, if I ever get to the point where I feel like you guys need that on a day-to-day basis, then we've got bigger issues to worry about. So we're not, the resuscitation devices, those are gonna be those pocket masks for those of you who are CPR trained. They are gonna be provided in the standard first aid kits in every room in the high school and in those backpacks that you pick up at the elementary. So those masks will be available to you in a standard first aid kit and will also be in the athletics. So I don't think those were previously, but I'm going to be adding those first aid cards, make sure there's gloves in them because I noticed a lot of them didn't have gloves. And then the first aid cards, the pocket mask, and the gloves. So. And I think that if you're wondering what is considered medical waste, so you clean something up and when does it need to be disposed of as blood or something infectious, it's only if it's pourable, drippable, flakable. So, if you are carrying something that is pouring, dripping, flaking, large amounts of blood that needs to be disposed of differently, again, if you're ever in that situation, I really hope you aren't, but really take caution. The rule on any of that stuff is really if you can't, I know all of our guts instincts, especially when it's a kid, you want to take care of the situation at hand, but you do have to keep your personal safety in mind also. If don't just jump head first into something that could be really putting yourself in a lot of danger also. So do what you can to keep that, but I hope that none of you, but if there ever is that amount, then it does need to be disposed of separately. Usually the amounts that you're coming across, even with a pretty good, cut in shop class or something like that, shouldn't be enough blood that it's considered biohazard waste. And then the disclaimer there is don't put your hand in a red bag or a sharps container. So keep away from that. Good. And then they're just talking about cleaning and disinfecting and laundry, and that's the same thing. Let us know if you need help cleaning up any of those things. We don't expect you to know how to do that. And I think that is pretty close to about it. Do you have any questions for me on any of that?
This is somewhat related. Are there plans at all for CPR training, in the upcoming school year or anything like that?
Yes, that's something that should be for spring again. They did it spring a year and a few months ago. So that will be coming up again. The decision is going to be made on if they, do they train the person here, in my position to do the CPR, or is it cheaper or more effective to have somebody come in and do it? So those decisions need to be made, but it should be for the springtime, so that you guys can do just a recertification instead of a full course, because we don't want that to lapse. So, yeah, it should be in place. Anybody else have any questions, comments, concerns? And if anything comes up and you don't want to ask it now, or just email me or stop by or let me know if there's anything else that comes up, or like I said, if there's something that doesn't work well with those folders, let me know and we'll do what we have to. So, all right.
What's your schedule for buildings?
The building schedule hasn't really totally been set. Usually it'll still be the Monday, Tuesday, Thursday, Friday. Give you as much coverage as possible, 8:30 to 3. It's probably going to be alternating, but with the hours of the health aide at the high school, the nurse will have to be covering the high school from 2:30 to 3 every day, except for Wednesday, which the nurse won't be in district at all. So Monday, Tuesday, Thursday, Friday, I'll always have to end my day at the high school because Carrie Steingraber isn't here until the end of the day. But we want somebody there to handle any type of health issue that comes up from the time, from 8 to 3. So, within those hours, please send us anything, and if anything happens outside those hours, let us know. But then the elementary will still get at least 2 of those days, and maybe some prorated time for losing the 2:30 and 3 on the other 2 days. No, I'm just kidding. But I'm sure that's flexible. As we all know, things come up in different buildings, and you go where you need to go. So if you ever need me, don't hesitate to pull me from where I am. It's not set in stone. So.